Hi, everyone. My name is Lori Kiefer. I'm a GI health psychologist at Mount Sinai in New York City in the Inflammatory Bowel Disease Center. And today I'm going to be talking about something I'm very passionate about, which is how do you harness your inner strengths and thrive despite being diagnosed with inflammatory bowel diseases. So I wanted to thank the organizers for inviting me. I am enjoying the fact that I'm able to Zoom into meetings outside of the New York area. And I hope I can at some point speak with all of you in person. So just to begin with, I wanted to acknowledge and embrace the balancing act of having IBD, right? IBD is not just about the medical condition. It's not just about the pain and fatigue and nutritional issues. It's not just about the bowel movements, right? There's a lot to it that involves managing your emotions, making sure you take good care of yourself. And then the other part of managing your IBD is really a bigger question, which is how do I still live a meaningful life with IBD? How do I do things that are of value to me and that make me feel that IBD is something that I live with, but it doesn't define me? And that's what I wanted to talk about today. So the brain-gut connection, as many of you heard, especially out here in the Los Angeles area, is hardwired before birth. And so they are inherently connected, which is why we cannot disentangle mental health and physical health, particularly when it comes to the GI tract. So here you are looking at the beginning of an embryo and things from the brain, cells from the brain are coming down from the brain into the GI tract before the baby is born, right? And so forever, the brain and the gut are fully connected and hardwired. And that really forces us to transcend this concept in Western medicine, unfortunately, of mind-body dualism. And mind-body dualism was started by a French philosopher, Descartes, but the goal of it was really to separate out the mind from the body in order to be able to study the body. Right? So at the time, the Catholic Church wasn't allowing bodies to be dissected or studied because they believed that they would somehow damage the brain or the soul. And so by doing that, by separating out the mind and the body, it served a really important purpose in medicine. The problem is we don't believe that anymore, but yet that mind-body dualism continues to pervade our culture. And so I'd really like to speak to you guys today about how we can start to move the needle on that and make sure that we're recognizing chronic conditions, particularly inflammatory bowel diseases, from the full biological, psychological, and social context. So today I'm going to talk about what are the emotional challenges faced by people living with IBD. I'm going to talk about how it's not just depression and anxiety that we need to be concerned with. I'm going to make a case for positive psychology and resilience-based care, really hoping that you walk away thinking that thriving is your goal, not just surviving with your conditions. I'm going to talk about some proven strategies that build resilience in the face of chronic conditions and how to find support in your community. So this was a large study that we did a few years back, looking at across all the literature in IBD, asking the question, what is depression and IBD's relationship, right? And we did find that patients with IBD, people with IBD, did have higher rates of depression and actually anxiety than the general population, but that this was really tied to disease activity. So you can see here on the second row that the patients with active IBD had substantially higher rates of depression as well as anxiety when they weren't feeling well, when their symptoms were active. And so that tells us something very important, which I'll speak about in a second. Secondly, Crohn's patients and ulcerative colitis patients did not really differ in terms of the prevalence of depression and anxiety. And I think that's really important to point out, because a lot of times, I think ulcerative colitis patients in particular hear that, oh, you have it better than Crohn's, at least you don't have Crohn's. Crohn's is more poorer quality of life, but we don't really see that bearing out when we look at it in the literature. And so I just like to make that point. And then interestingly, we also found, however, that there was something about IBD patients versus other chronic conditions, so rheumatoid arthritis or psoriasis, diabetes, variety of other chronic conditions, that the IBD patients actually did a little bit better in terms of their prevalence of depression and anxiety compared to other diseases, suggesting that there is a resilience to people who have this particular condition. And again, that could be the resilience between the brain and the gut that we're able to harness. So going back to why is depression and anxiety more common when disease is active, that's because these conditions, depression and anxiety, and IBD, are really bidirectional, right? So many of the symptoms of depression overlap with IBD: loss of appetite, loss of concentration, poor sleep, low interest in doing things. A lot of times that's protective for people. When you're not feeling well, the body is purposely sort of keeping you from going out and doing things, right? Depression also is important in IBD because it interferes with our ability to self-manage. We're less likely to make that extra trip to the doctor. We procrastinate getting blood draws or procedures done. We sort of don't engage with people as much as we normally would. We're just sort of getting through our days. Depression is a consequence of deprivation and restriction. So imagine if you're coming off of a long flare, you haven't been out to see your friends, you're coming off of a long pandemic, haven't been out to see your friends. You can really create a cycle of depression in the brain chemically, not just emotionally. And then we all know that there are many IBD treatments, particularly the corticosteroids, that can affect mood, but also body image. A lot of my patients will say, like, when they have been on prednisone for a little while, that they start to feel really uncomfortable leaving their house because they feel self-conscious about their appearance or any weight gain they might have or the puffiness in their face. And so that's why it's really hard to disentangle depression from inflammatory bowel disease. And that's why it's such a sort of big question in the literature is, what is that relationship? We know that they're commonly comorbid, commonly occur together, but what is that link really? But I also think it's important to look at other challenges that, depression and anxiety are only one set of emotional consequences of inflammatory bowel disease, right? And luckily, there's been a huge explosion in the last 5 years or so looking at the other challenges of inflammatory bowel disease that patients have. And here's just a sort of a smattering of different topics that many of you probably do relate to. Another big trigger of symptoms for patients, or even their sort of tendency to want to avoid stressful situations, comes from research that shows that perception of stress increases the odds of somebody having a symptom-based flare. And this comes out of a great group in Manitoba, Canada, where they looked at a variety of different environmental triggers of symptomatic flare in Crohn's and in ulcerative colitis. And you can see here that the perception of stress, high perceived stress, was associated with almost double the risk of going on to develop a symptomatic flare. So again, we can't really ignore stress when we're talking about inflammatory bowel disease. The good news, and this is what I'm hoping to talk to you about today, is that while we can have stress in our lives, and many people will even say, I developed my disease after a stressful period. The good news is that how we perceive stress is something we have control over. It's how we can learn how to deal with. And I'm going to spend some time giving you some proven strategies to do that. Unfortunately, there's a major gap between IBD patients and their providers with respect to psychological concerns. And this was a study done by Dr. Tiffany Taft, looking at how patients felt their emotional health was managed in IBD settings and IBD care. And you can see here that patients are really embracing this this holistic model of care, right? They're embracing the idea that I can have Crohn's and body image disturbance. I can have Crohn's and stress can affect me, even though I know stress doesn't cause my symptoms. And we're really working on trying to close that gap so that providers are asking patients more about the impact of their disease on their lives, and not just on their work or on their school, but on their family, on their relationships, on their mental health, on their stress. What are they avoiding? What do they want to be doing? We're really trying to open up that conversation. And I would encourage all of you as patients to not be afraid to bring it up to the providers. We know that the providers actually want to know it. They're just afraid to ask. So if you tell them, they will be happy to have heard the information. They just are not in the habit of sort of conducting that well-being review of systems like they do with everything else. But please, as patient advocates, please make sure you are talking to your doctors about these issues as well. And then we are working on the doctor side to get them to bring it up more often in your visits. So I want to sort of, those are sort of the basics of what is known about the risks of mental health and IBD and sort of the combination of that. But unfortunately, and having been in the field for 20 years myself, it's been really hard to move beyond what we consider sort of a reactive approach, right? So many centers have recognized the importance of mental health in IBD and have implemented a variety of screening methods. So here's an example on the slide where you have, you take a questionnaire when you check in, and the questionnaire is focused on picking up depression or anxiety, and that kind of triggers the medical assistant or the nurse or the physician to say, oh, wait a minute, I better ask this patient about mental health, which again, great. And then hopefully refer to a mental health provider. Many places have integrated care, integrated social workers or community members that they might refer you to. And then that person can really engage the patient in supportive counseling. And then if things don't improve, they might refer on to a more complex setting, psychotropic medications or pain management program and that type of thing. The problem with that model is that once you screen positive for depression or anxiety, your self-management skills are already slowly starting to wane, right? You're already less engaged in your care. You're already suffering. And it's almost, I don't want to say too late, but it's not an ideal time to engage in treatment. And so we're really trying to switch this concept to not waiting until somebody has screened positive for depression or anxiety, but instead really focusing on emotional well-being at the point of diagnosis at every visit as a way to make sure that nobody gets to that point, to that negative consequence of having developed depression or anxiety or a substance abuse problem or chronic pain in the setting of their inflammatory bowel disease. So that brings me to the concept of positive psychology. Positive psychology is our way around medical dualism. It is the study of human flourishing and optimal human function. It's a study of talent. It's the study of your athletes that you admire or the movie stars. Why are they so good at something? How do they flourish in this environment? And really what we're asking with respect to positive psychology and IBD is, why do some people who have terrible disease or who are really struggling with their medical management or their surgical management, why do they thrive? And how do we bottle that up and give it off to other patients who maybe don't have that same hope or optimism? So we've sort of flipped the question on its head and said, what are the risk factors for depression and anxiety? Yes, those are important to know. But we also kind of want to know, what are the reasons people thrive, and how do we train our IBD patients and help them become warriors with their disease early on in care? And we do that through something called resilience-driven care. And resilience is really at the center of positive psychology. Resilience is the ability to bounce back after encountering a difficulty. So for us, a diagnosis of Crohn's, a diagnosis of ulcerative colitis is the difficulty. And can we, at that point, bounce back and not just make it back or some semblance of who we used to be, but really bounce beyond what we might have been because of the silver lining in learning what we've learned about having a chronic condition. Are we a more empathic person? Do we feel more connected to our loved ones? Do we figure out who our real friends are? How do we bounce back? And that's the resilience component of our care plan. It's being able to have symptoms, to have pain, to have adversity, to have a stoma, to have a J-pouch, to have an ostomy, and still live one's life despite it, to have pain and discomfort and shame and embarrassment that might happen because of the symptoms, and still live the most meaningful life for yourselves. And the good news about this is, not only does resilience, psychological resilience, tie directly to perception of stress. You remember when I had mentioned that how we perceive stress is related to coping, but resilience itself can be taught, and it can be taught particularly well when you are facing an actual adversity. And I'm going to talk today a little bit about that. So this was a study that we did back in when I was at Northwestern with Dr. Jennifer Keebles, where we really were able to show that the degree to which somebody accepted their condition, accepted their diagnosis, not approved of it, but accepted it, and bounced back, or used that as a goal to bounce back, really differentiated their quality of life and their perception of disability. They were able to not only just accept their condition and say, you know what, I don't like this, I don't approve of it, I have to change my lifestyle, I maybe had to miss a semester at college, I don't like it, I don't approve of it, I don't want it to be the case, but it is the case. So the only way forward is to figure out how I'm going to incorporate this into my life. And the patients who were able to say that in our study were able to adjust to the changing demands of their disease across the lifespan. So not just at the point of diagnosis, but we all know, you might be doing fine and then you have a disease flare. You might be doing fine and then decide you want to get pregnant with IBD and, have some different questions. You may be really sick and then all of a sudden find yourself well and don't know what to do with yourself. These transitions are opportunities to bounce back. And that's what I'm really excited to share about with you today. So that was a study back in 2009, 2010. And then most recently this year, we were able to show that not only was it a mental state to have resilience on your outcomes in IBD and your ability to self-manage and adjust, but it actually was also associated with lower disease activity and better quality of life. So patients who had, or sort of 800 patients were, I'm sorry, 300 IBD patients were sort of categorized into either high resilience or low resilience based on a screening questionnaire that we offer at the Mount Sinai Center. And patients who had high resilience by the scores on that screening questionnaire had lower disease activity measured by either the Crohn's disease activity index, ulcerative colitis disease activity index, and they had better quality of life. And then when we looked at the people in that group that had low resilience, they had higher rates of depression and anxiety, higher disease activity, and poorer quality of life. So there's, this is obviously needs a lot of fine tuning, but I think it's a great concept that we're not talking about resilience just because it helps mental well-being. We're actually saying it could influence your disease experience, your physical well-being as well. So I've had the pleasure of working with Marla Dubinsky, who used to be out here in LA at Cedars-Sinai for the last 5 years at Mount Sinai, where we've developed what we call the GRIT program, Gaining Resilience Through Transition. And we've taken all of that science that we've done over the years and really focused in on what we call our psychological treat to target. So again, a positive psychology approach. What are the key ingredients that patients need to thrive despite their disease? One being that acceptance that I just talked about. Another being optimism and hope, social support, self-confidence, the ability to tolerate and regulate stress and pain and discomfort. And all of that combined, those targets that we sort of go after in our IBD program at Mount Sinai lead to a resilient warrior IBD patient. And so this is where I want to sort of talk about, how do we get you there? How do we make you a IBD patient who thrives with their disease? So the characteristics of a resilient person are people who have passion and people who can persist. So when life knocks you down, are you able to get back up and start over again or do something different? Can you recognize and use your personal strengths that everyone is born with to cope and recover from problems and challenges? And there's a variety of different ways that you can do that. And then finally, can you protect yourself from the negative effects of stress by making sure you have people in your life that support you? So first, growth mindsets. Do you believe that people can change? This is a key component of resilience and of positive psychology. So if you can believe that people are on the right side of the slide are malleable, they can improve, they can rise above challenges and obstacles, then they're more likely to succeed. They're more motivated to learn from their mistakes, right? Schools are set up around a growth mindset most of the time, where, as you learn things, as you have feedback, you keep growing as a person. We need to keep growing throughout our lifespan, and we need to keep changing with the times throughout our lifespan. Unfortunately, if you don't believe that, if you are somebody who sort of thinks of things as this is just who I am and I can't change, then something like a diagnosis of IBD or something like an adverse outcome from a surgery or failing a medication is really going to lead you to avoid challenges, to avoid making changes, and to settle for really untoward outcomes. So I would encourage all of you to take a character strengths quiz, which you can do for free on the University of Pennsylvania website, and the link is right here for you. Because there's sort of this idea that there are 24 human strengths, and we all have the strengths, but we have them in different degrees. And so if you know what your strengths are, you might be able to place yourself in situations where those strengths are the most valued or the most harnessed. So for me, when I took my 24 VIA characters test, my top strengths were curiosity, optimism, humor, perspective, and then the capacity to love and be loved. And so knowing that about myself now, I'm able to really recognize times when I can put myself into activities that harness that. So for example, when we're engaged in our strength-based activities, what I call green activities, we are much more likely to find ourselves enjoying what we're doing, feeling energized by that. So for me, curiosity, when I'm learning something new, when I'm studying a new topic, when I'm meeting with a patient and they're telling me a new story, that curiosity is really something that makes me feel in flow, something I look forward to, and I can even do it when I'm not 100% feeling great. Right? Something could be bothering me, or I could be feeling symptoms, but it doesn't matter because I'm harnessing my strength and I'm able to override that. Red activities are things I don't like doing, right? They're things that I'm doing that are not tapping into my strengths. So for example, one of my lowest strengths on that VIA character strengths test is appreciation of like a creativity sense, right? So I'm terrible at art. I used to have to go to special art lessons as a kid. I still don't like doing it. I still don't like helping my daughter do it for her homework. That's a red activity for me. It seems to pass slowly. I feel drained. I need a nap after I do things like that. And so I try to set up my weeks so that we all have to do red activities, but maybe we can do them less or make sure they're counterbalanced with our green activities. So take their quiz and figure out what are the things that you're doing in your life that are harnessing those character strengths just off the bat. Another character strength, or another part of our psychological treat to target, is optimism. And, you know, again, people often ask, are you a half full or a half empty person? And the good news is that optimism is actually the way we interpret life events, and it can be changed. It can be learned. It doesn't have to be Pollyanna. Everything is amazing. Everything is great. Nothing's going wrong. We can have realistic optimism, but we do that through our explanatory style. So when things go wrong, for example, an optimist is much more likely to think of the thing that's going wrong as temporary. We're going to get through it. It's happening now, but it's not going to be forever. Whereas a pessimist will say, that's it, life's over. I'm never going to recover from this. This is permanent. Pervasiveness. An optimist is going to see the challenge as something very specific, right? I need to work through this one particular issue with a stricture, or I need to follow a low residue diet. I need to do something very specific related to this challenge, versus universal, right? Everything's changed. I can't do anything anymore. My whole life is now embodied by this challenge. And then finally, personal. So an optimist is going to look at things as external. Bad things happen. It wasn't necessarily my fault. This is what I have to do. I approve. I don't approve, but I accept that I have to kind of move on from this, and that, you know, things happen, and this wasn't related to something that I did or some internal flaw of mine. Whereas a pessimist is much more likely to sort of indicate that, you know, this happened because I'm a terrible person, or I'm being punished by God, or you know, there's something about me that's inherently broken, right? Patients often say to me, I'm broken, I'm damaged. You know, that sort of belief that when bad things happen to you, it's because of some internal failure. And so those are things that you can work through cognitive therapy. There's a great book called Learned Optimism by Martin Seligman that kind of talks about how do you start reattributing good and bad events in a way that is more of an optimism way. And the reason that's important is optimists live longer, optimists have less health issues, and optimists tend to be happier people. The next thing I'm going to spend a few minutes on is the concept of savoring positive emotions. There are so many negative things that go on in life, and a lot of times when positive things happen, we savor them very briefly and we sort of let them go, and it's very easy to focus on some of the negative things. But we know from the science of positive emotions that positive emotions really promote resilience, and they reduce a lot of the suffering associated with pain and discomfort and disease. We also know that positive emotions can really, if you savor them, you can counterbalance the negative emotions. So we're not saying that you can't have negative emotions, but if you do have a lot of negative emotions, one strategy is to make sure that you're also hunting the good stuff, finding some things to positively savor. And I'm going to talk about how to do that in a minute. Positive emotions is connected with positive heart health. It can be done vicariously as well as personally. So you can celebrate your own positive emotions, but you can also experience joy in somebody else's emotions or pride in somebody else's experiences. And you can also savor past, present, or future. So you can think about a bad time, a good time in the past to counterbalance something you're going through now. You can think about something you're looking forward to as a way to savor positive emotions. There's a lot of ways to do that. What are some positive emotions? On the slide, you can see joy, excitement, gratitude, interest, serenity, amusement, pride, hope, inspiration, awe, and love. I mean, those are a bunch of them that you can kind of think about which ones you tend to experience sort of naturally and what ones you might want to kind of go after. But when we've looked at meta-analyses of people who are able to savor positive emotions, they have better health. And so I think if you already have a chronic health condition, anything you can do to promote your health and well-being is important. Now, it's not just about the positive, and this is important too. I'm going to share a new word called emodiversity. So just like we have our gut microbiomes and we're talking about bacterial diversity, we need to have emotional diversity, right? We can't just go on and off switch of positive and negative. We want to have a range of emotions and make sure that we are experiencing the full range of human experience that helps us feel more connected. And people with less inflammation actually, or people who have a higher range of emotions actually have lower inflammatory processes, which I think is really exciting and relevant to inflammatory bowel diseases. Gratitude is another really positive emotion that many of us are able to express, especially nowadays when we sort of are looking around and recognizing some of our privileges, both in the US and around the world. And I often encourage my patients to really focus on, coming up with things that they're grateful for, and not just why they're grateful for them or things that went well that day, but to make sure that they are attributing why things went well to positive reasons. Things went well because I have awesome friends. I'm really grateful for those flowers that I received when I was feeling sick. And that's because I have such an amazing friend or family group. Social support is another really important area of building resilience. And that is, we know that both scientifically, social support is a positive buffer against a variety of stressors. And people who have negative social support, so not just the absence of social support, but people who hang out with, toxic people who have poor relationships, actually have much higher health risks, similar to as if you smoked 15 cigarettes a day, were a substance abuser, had obesity, or weren't physically active. Low social support and poor and negative social support is actually just as serious of a health issue. And so I'm going to talk in just a second about the importance of that to IBD. So I don't know if anyone looks at these little furry friends of ours, but and if you've heard me speak before, you may have heard this story, but these are my favorite little animals. They are the cotton-top tamarins. They are monkeys that inhabit sort of Colombia and South and Latin America, and they are genetically predisposed to develop ulcerative colitis in the wild. But they never get it in the wild, and they only get it during captivity. And initially they thought when they were in captivity, it was the stress of the captivity that triggered the onset of ulcerative colitis. And while that might have been somewhat true, they were able to kind of control for that over time in scientific ways to show that, you know, the tamarins never kind of recovered from that stress, which they should have. And when they went back to the wild, their ulcerative colitis went into remission. They checked around with a diet. They thought maybe if we fed them weird things while they were in captivity and altered their microbiome, and that made them predisposed. But that also seemed to not be the case. Long story short is when they finally realized, after controlling for all these other factors, that the mistake they had made in captivity was they had put the cotton-top tamarins in pairs in cages, and that was how they held them. They had plenty of space. They lived in their habitat. You know, it was a relatively comfortable environment, but they were in twos. And the cotton-top tamarins live in groups of 3. And so by disrupting their social structure, they were not able to recover from the stress of captivity because they were missing a key part. They were missing another tamarin who they normally would use to sort of buffer them against the stress. And so I like the story for ulcerative colitis and for Crohn's disease because I think it really shows the importance of who's there for you when things go right. Who's there for you when, you know, who do you need in your life when stress happens? And that can be really important. Now, another part of social relationships, of course, is about having a relationship with yourself, right? And self-compassion, we know, can really make us more resilient, and particularly in the face of adversity. So when you're finding yourself obsessing or fixating on things that have gone wrong, or things that you've failed at, or you feel inadequate about, or that other people are living the life and you're left behind, there are some strategies you can use to make yourself feel a little bit better. One is sort of connecting with other people who might also be suffering, right? Suffering is part of the human experience. So I might be feeling like really bad, but I actually, other people feel bad too. It's not just me. When I fail at something important, failure is part of the human condition. Again, that growth mindset. And then looking at other people, they're having an easier time of it. Trying to sort of be understanding and have compassion for other people's successes and recognize that they probably have suffering you're not aware of as well. And then finally, if all else fails, you say, would I treat a friend this way? Would I talk to a friend like I'm talking to myself? Probably not. And so really working on how you talk to yourself can be really important. Okay, so I kind of gave you a bunch of strategies that are part of that positive psychology, but I wanted to just briefly put up this slide around what is a therapist, because many people don't always know the difference between a psychologist, a health psychologist, which is what I am, meaning I am a psychologist who applies psychology principles to health conditions, pretty much exclusively, right? And so when you're looking in the community for therapists, you might not find somebody with GI psych experience, but you might find somebody who says they are a health psychologist or a licensed social worker specializing in chronic illness. So these are some of the ways you can kind of look for help in your area. And look for some of the therapies that have been proven in IBD: cognitive behavioral therapy, mindfulness-based therapy, acceptance and commitment therapy. Those types of people who list those as their therapy orientations might be really helpful. Here's a list of some resources as well, where you might be able to find a therapist in your community. I know we do have some people out in the Los Angeles area, and one of my favorite sites is the RomeGIPsych.org site. We've created a psychogastro community that's international, where we're trying to build members of people who want to see patients with inflammatory bowel diseases and other GI conditions, and sharing resources and best practices. So I'd encourage you to look at one of these sort of vetted websites as well. And then finally, I just wanted to put up some book recommendations for those of you who are really interested in the positive psychology concepts I spoke about. So there's the Seligman book, Learned Optimism, and then there's some other books on gratitude and self-compassion. I hope that I've kind of convinced you that it's not just about mental health and IBD. Thank you.